In the last 20 years, we have always told our patients one of the reasons for people suffer from depression and anxiety is due to lack of serotonin function or activity in their brain. This narrative may have to change, since a new article published in Molecular Psychiatry recently debunked the theory of serotonin association with depression. What does it mean to us? Welcome to Dr. Yang's Health Talk. Health is our number one asset. Let's take good care of it. Well, first of all, this research paper is telling us what we believed in the past is not a clear cut. It's a hypothesis and a theory that serotonin deficiency is causing anxiety and depression. They evaluated all the researchers and studies investigating serotonin association with depression, including the level of serotonin and the function of the serotonin receptors and the serotonin transporters and the genetics that affects the serotonin transporters and so on and so forth. The conclusion was pretty negative. Basically, they concluded that there's no evidence between serotonin and depression in all the areas they have investigated. However, to some people, they would say, no wonder it didn't work for me. But for other people, they will be puzzled because the medication that improved their serotonin function did improve their depression. I have one of the such patients who suffer from major depression, PTSD, and severe anxiety. She tried many different medications before she came to me, and she has been stable and functional on one of the antidepressants that improve serotonin and norepinephrine function. However, she developed high blood pressure and tolerance to this medication, so she had to get off it. After she got off it, her symptoms all come back because medication does not treat the cause of the problem. It does reduce the symptoms. So we had to put her on a SSRI, selective serotonin reuptake inhibitor, and that is to reduce the activity of the transporters of serotonin in the brain, so the serotonin will remain functional in the neurons in the brain. And she got better again. Her symptoms reduced, her anxiety reduced, her depression reduced. She began to function well again in the last 6 months. However, she did develop some side effects, including weight gain and blurred vision, and a very unusual symptoms, the feeling of having insects crawling on or under the skin. There's terminology for it called formication. Not just the SSRI, the many other medications can cause the same problems. The question is, if SSRI works for this particular patient, what's the mechanism behind it if there's no association between serotonin and the depression? Of course, we do know today SSRI antidepressants also affects the immune system in the body and the brain and reduce inflammation. The Luvox, one of the SSRI, was even discovered to have therapeutic effects on COVID-19. The modern science is still young and the technology is still developing. We shall learn more and more as time goes by and to prove we were right or we were wrong in the process. If you have any experience and insights on antidepressants, please share them with us in the comment section. It is Dr. Yang's Health Talk. Thank you for watching. We'll see you next time.